Hello, everyone. My name is Yihua Chu. I am an associate professor in the Department of Sports Medicine at Kaohsiung Medical University in Taiwan. First of all, I would like to thank the International Organization for Health, Sports, and Kinesiology for inviting me as a keynote speaker. And today I'm going to talk about the effects of yoga on mood and heart rate variability. Again, so this is the topic of today's talk, and this is the character of my name in Mandarin. And I'm going to give a brief introduction to yoga and then move on to talk about the effect of yoga on depression and on anxiety. Those are the most common mental disorders in Taiwan and I believe also in the United States. And lastly, I will talk a little bit about heart rate variability. So let's start it. And yoga. Okay, I believe many of you already know what it is like and what it is from. And so yoga is a mind-body practice in complementary and alternative medicine. And it is an ancient practice that is rooted in Indian philosophy. There are quite a lot of different styles of yoga, but most of them emphasize physical postures, which are also called asanas in Sanskrit, and breathing techniques, pranayama, and meditation. Yoga is also sometimes called meditative movement practices. Except for yoga, Tai Chi and Qigong are both considered meditative movement, as this practice include both the physical component and also the meditation component. And as I have mentioned, there are a variety of different styles, including Hatha Yoga, Ashtanga Yoga, Iyengar, Bikram Yoga, which is the hot yoga, and Vini Yoga. These styles are very popular in Taiwan and also in many of the Western countries. And some of the yoga styles were quite intensive. As, for example, Ashtanga Yoga is considered an intense yoga styles. And there are also some other styles, they are relatively more relaxing, for example, the Hatha Yoga. And the problem with this many styles in yoga is that it posed challenges in research because different styles may have different health effects. Like, for example, physically, if you practice Ashtanga Yoga, which is of a higher intensity, you might be able to see more improvement in cardiovascular fitness as compared to more relaxing style of yoga, you might not find the same result. And it's also the same for mental health. So it can be really challenging and problematic when compared between styles in terms of their benefit for different health effects. And also it is very important for the study to report their style being used in the study. Otherwise, it will be very difficult for the research to compare among studies. The use of yoga for health in the United States is one of the top 10 complementary and alternative medicine modalities. And in Taiwan, yoga is also one of the most popular types of exercise in Taiwan. It ranked top 10 for many years, especially very welcome, very popular in female populations. And the reason for using yoga, it's for a variety of health conditions, especially for anxiety, depression, and physically for asthma, high blood pressure, low back pain, and neck pain. For those who does not have those health concerns, people will usually practice yoga for general health, for example, to improve their physical fitness and for relaxations. For many of the yoga styles, you will see improvement in muscular strength, muscular endurance. Some of them might find improvement in cardiovascular fitness and also in balance. And flexibility is probably the most commonly outcome that you can see in the improvement in physical fitness. And also people using yoga for general relaxation to relieve their stress. So let's move on to our second topic, the effect of yoga on depression. There are quite a lot of studies that have examined the effect of yoga on depressive symptoms in general healthiest adults or in adults with mental disorders. And the first review was done by Bridget et al. Um, it was published in 2017 in the Journal of Evidence-Based Complementary and Alternative Medicine. In this review, 23 intervention studies were found to be published between 2011 and 2016. Most of the studies were randomized controlled trials, and they have used various styles of yoga, including Anusara, Hatha Yoga, Iyengar Yoga. Some of them use mindfulness-based meditation, which also include yoga pose practice, and also mini yoga. And the number of participants in these individual studies range from 14 to 136, which means that some of the studies use relatively smaller sample size. And the intervention periods ranged from 1 week to 24 weeks, with the average of this intervention ranged from 8 to 10 weeks. And the frequency of practice was about once per week to daily, and the duration of each session is about 12 minutes to 90 minutes. And in this review, yoga was found to be effective in reducing depressive symptoms in the majority of the interventions. About 14 studies have shown this result. For the rest of the study, they found either improvement in both yoga and the control groups, or they found no significant changes in both groups. And individuals with elevated level of depression was found to be able to benefit from yoga interventions. And when they compare among different yoga styles, it was not evident if any one type of yoga was superior or better than the others. So you can say that if you practice yoga regularly, regardless of the style of yoga, you will be able to gain benefit from yoga for treating depressive symptoms. Another more recent review was conducted by Brinsley et al. It was published last year in 2021 in the British Journal of Sports Medicine. In this study, they included only randomized controlled trials, and there were 19 studies that were included in the review, and 30 studies were included in the meta-analysis. And they recruited adults with a diagnosed mental disorders, including depression, anxiety, schizophrenia, post-traumatic stress disorders, alcohol dependence, and bipolar. And the sample size in these studies range from 18 to 122. Again, some of the studies use a smaller sample size, and 69% of the total sample were women. The intervention period on average is 6 to 10 weeks, and most of them were between 8 to 10 weeks. The frequency of practice is about 1 to 3 sessions per week, and the duration is about 20 to 90 minutes per session. And the types of yoga practice, as we have mentioned before, quite similarly, they practice Hatha Yoga, Vinyasa, Kundalini, but there are quite some studies, they do not specify the style of yoga that were used in the study. For most of the reviews or the study that we have seen, Hatha Yoga is pretty much the most common yoga style that were used in the individual studies. And most of this yoga style involved body movements, breathing exercise, and or mindfulness or meditation. And also, very importantly, in this particular review, they recruited studies they have movement component. They made up for at least for more than 50% of the intervention. So in this study, in this review, most studies were more physically active in the practice of yoga as compared to some styles they may only focus on meditation or mantra chanting, more of the sedentary style of yoga practice. And most of the yoga sessions in this review were supervised. only two studies use home program. And the result of this meta-analysis showed that, as you can see in this figure, most of the study shown the result were in favor in the yoga group for reducing symptoms of depression as compared to the control groups, which includes usual control, attention control, or waitlist control. So in conclusion, the yoga has a moderate effect on reducing depressive symptoms across a range of diagnosed mental disorders. So you can say that yoga might be a viable diagnostic treatment or intervention for the management of depressive symptoms in individuals with mental disorders. And also, very importantly, there was a dose-response relationship between the frequency or the number of sessions per week and the improvement in depressive symptoms. So when you were designing a program for individuals with depressive symptoms, you need to focus on increasing the frequency of yoga practice as opposed to increasing duration of yoga practice. Okay, so that's about it for the effect of yoga on depression. Let's move on to the effect of yoga on anxiety. There were relatively fewer studies that had focused on this topic. And in 2013, Sharma and Heather, they have conducted a systematic review. And the study was published in the Journal of Evidence-Based Complementary and Alternative Medicine. In this review, they included 27 studies. They were published between 2010 and 2012. And 18 studies were randomized trials. The others were either quasi-experimental studies or a single-arm study. And the type of yoga that were used in the study included Hatha Yoga, Iyengar Yoga, SKY, and also other unspecified style or techniques that are related to yoga practice. The intervention period ranged from single bout of practice to 7 months, and the frequency of practice is one session per week to daily, with the duration of each session ranged from 20 to 120 minutes. And in this review, they found 19 studies out of the 27 demonstrated significant reduction in state and trait anxiety. The author also indicated that supervised training session demonstrated more significant reductions in anxiety. So if you were designing a program for individuals for treating their depressive symptoms, you need to really consider having them come into the session or at least have a yoga instructor to supervise their training session to have the most benefit. But they also indicated most studies measured anxiety with comorbidities, which includes cancer, menstrual disorder, restless leg syndrome, schizophrenia, or eating disorders. So again, you can say that yoga may be also a viable intervention as a diagnostic intervention for people to manage their anxiety symptoms in individuals with mental disorders. And lastly, let's talk a little bit about heart rate variability. So what is heart rate variability? It is the variation in the time interval between consecutive heartbeats. It is an important measure for cardiac autonomic control. More specifically, it's a measure for the sympathetic and parasympathetic influences on the heart. Many clinical indicator or studies use heart rate variability as a proxy for the health, adaptability, flexibility, and neuroregulation of the cardiovascular systems. For the heart disease patient, heart rate variability may be used as an indicator of prognosis or future mortality. And for diabetes patients, they also use heart rate variability for diagnosis of autonomic contraindications. So this is heart variability. If you look at the figures, you can see the interbeat intervals were different in time in milliseconds. So that's the variation of the time between each heartbeat. And heart variability has been shown to provide a lot of information about physical and mental health. It was shown to positively associated with physical fitness and with psychological health. It has also been shown to negatively associated with cardiovascular disease and negative effects. It was a major to demonstrate the body's ability to respond to stress internally and externally. In general, higher HRV is indicative of a healthier cardiovascular system and a better stress resilience, which means you are more able to manage your emotional and stress response. And it has been shown in the previous literature and research that poor mental health has been linked to reduced HRV. Therefore, since we have found from previous study, as we have just presented, that yoga has been beneficial for a number of different mental disorders, especially depression and anxiety. And both depressed and anxiety population has been found to have reduced HRV. So researchers also began to look at the influence or the impact of yoga practice on HRV. And for this topic, there was a review done by Tyagi and Cohen in 2016, and the study was published in the International Journal of Yoga. In this review, they included 59 studies, and only 16 studies were randomized to controlled trials. And the majority of studies in the review were observational study, about 33 of them, and the rest of study were either cohort study or not a randomized control studies. And the types of yoga they were included in the review, there were Hatha Yoga, Kundalini, Iyengar, Vinyasa. They were also studied to use only Yoga Nidra, which is this yogic sleeping, and also the mantra chanting. So this style of yoga is not as active. It does not include a physical practice component in the yoga sessions. And of course, there are still other studies that do not specify the styles of the techniques that were used in the study. And yoga practice, according to this review, that appear to improve autonomic regulation and enhance vagal dominance or parasympathetic dominance. They have found this with the changes they found in the HRV. They also found that for the yoga practitioner, that yoga practice regularly increase their vagal tone as compared to non-yoga practitioner or sedentary individuals. They also found that yoga breathing practice have a profound effect on HRV, especially when you breathe slowly. Slower breathing was shown to be able to increase HRV. But they also mentioned in their review that most studies that have examined the effect of yoga on HRV were of poor quality, and they use a range of heterogeneous measures, make it difficult to compare among studies. Also, they mentioned that few studies provide details of respiratory rate. As we have mentioned, respiration can have profound effect on HRV. So without this information, it's difficult to distinguish whether the change in heart variability is due to the change in cardiac autonomic regulation or due to change in respiration rate. So they really suggest more rigorous studies with detailed reporting of yoga practice and the changes in respiration to help the researchers to further examine the potential effect of yoga on the heart rate variability. Okay, so in summary, from this literature review and meta-analysis, we found that yoga is an effective mind-body practice in reducing symptoms of depression and anxiety, and is effective across a range of mental disorders. And also we found that the higher frequency of practice is preferred. So when you are designing a program, especially for depressive symptoms, for individuals with these problems, you will need to focus on increasing the frequency of practice, and that will give you more benefit from your practice of yoga. And lastly, to date, yoga appears to be improving the cardiac autonomic regulation as reflected by increased HRV in most of the studies. But again, the study that have been reviewed now, most of them are of poor quality. We still need more rigorous study. They provide more information about yoga practice and also information about respiration rate to further elucidate potential effect of yoga on heart rate variability. All right. Thank you for your attention. Again, this is my information. And before I end this talk, I would like to promote our special issue. I'm currently a guest editor for the International Journal Environmental Research and Public Health. Our special issue is Yoga and Health, and we encourage submission of manuscript that examine both the acute and chronic effect of yoga practice in populations across all age groups and with various health conditions. So if you're doing some related research and you would like to publish your result, you're very welcome to contact us. You can contact us through the QR code here, or you can send me emails, but you have to do this soon because the deadline is approaching. It's November 30th this year. So if you have any question, please send me an email. I can give you more details about the submission processes. So again, thank you all for your attention. And if you have any questions, you are very welcome to send me an email. I'm more than happy to answer your questions. Thank you very much. Goodbye.